And what a great organization. And VCOM is terrific. This Northside clinic is terrific. But this just goes to show what happens when there is a need and there are people willing to step forward and do something about it. And with the COVID upon us, we got to move quickly, and that's what we did here. This is a magnificent example of what we can do in South Carolina when we put our minds to it. The good news is there's all good news. We've got more vaccine coming. The Moderna and Pfizer have been here. Johnson & Johnson, we're about to get to our millionth dose in arms. We're doing a lot better than the numbers show. The numbers get tangled up in the recording, but we're doing extremely well. Our economy is open. We never close down. Our people are smart, determined. We've learned how to combat this virus, and it's because of that and because of this kind of initiative that we're doing very well. The Johnson & Johnson is supposed to arrive either Friday or Saturday. There won't be as much of it coming in the beginning as there was when they opened the door for the Pfizer and the Moderna, because that had already been produced and was stockpiled awaiting FDA approval. That has not happened with Johnson & Johnson, which came along later. But the good news is we're going up with vaccine, and sometime in March we ought to have plenty of vaccine. We won't have enough for everybody, but we'll be getting a lot closer. There are a lot of people who don't want to take the vaccine for various reasons. We're trying to reach those who want to take it and to reach those who want to be assured. But I want to thank all involved for doing this today. It takes a team. We've got a great team in South Carolina, and for this to take place here in Spartanburg, in South Carolina, is a great thing for all of us. And so this again is another example of how well things work when we use our heads, get all our assets together, collaborate, communicate, and cooperate. This is what you see. So thank you very much for everyone involved. Yes, you mean from the beginning or just
recently?
Recently, yes, we only have a few limitations. We have a lot of the standard recommendations, but in seeing the numbers going the way they were going down, the positivity rate going down, the vaccinations coming up, and we had record vaccinations just last week. I think one day was 24,000 in one day,
yes.
And then a couple of days later we had 40,000 in 2 days.
28,000 and 40,000. So we're doing much better, yes, sir.
Doing much better, and you understand as well that we know for everyone who tests positive, there are many more who have had the virus but have not tested positive, haven't had a test at all. And so that immunity, to the extent that it lasts, is building up. But we are vaccinating more and more. People know how to be careful. And so watching those numbers, it was time to remove those limitations, the 11 o'clock last call, and also those on the size of gatherings at 250. We removed that as well. But we're still counting on the people of South Carolina to use the common sense. We all know what the rules are, but we need to take care of ourselves and take care of our neighbors. That long answer to a good question.
The topic of off-topic questions, the letter right now among the governors to the Biden administration regarding the coronavirus relief. I know a lot of people are looking for that relief, stimulus checks, things of that nature. But you feel that it's not the right move. This is not the right package.
Well, they were basing it on. They're not basing it the right way. We didn't think, and there were 21 or 22 of us. 21. The way, for example, the way the vaccine has been distributed, the vaccine itself has been distributed here was based on population. South Carolina, in the beginning, there were 57 million doses. Some had been stockpiled up during the Trump administration. You remember they were producing the vaccine before it had been approved. So when it got approved in December or whenever it was, they already had millions of doses to go out. So how did they send them out? How did they decide? Strictly based on population, per capita, pro rata that is, every state, based on their population 18 years old and older. That way there's no argument of anybody getting favoritism or anything else. It's strictly based on, and that's a good way to do it. And that's the way that's the basis of how we're looking at the basis. There could be some exceptions and modifications the way we're looking at distributing it around the state. But when now it's coming to money, and there's funds that are going to be going out. Well, we thought, the 21 of us governors thought that the best way to do that is the best way, the same as the vaccine, to do it on a per capita basis. That is, if the state has twice as many people, then they ought to get twice as much money. But every individual counts for the same amount. But the Biden administration is putting other factors in there, some of which reflect not the result of the virus, but the economic conditions in the states prior to the virus. Well, this is not supposed to be a bailout for performances prior to the virus. This is supposed to be in response to the virus. So our belief is the only fair way to do that is could be beyond criticism is do it based on population. That's why we said that.
Do you believe there is an urgency to get relief to folks in the form of some kind of coronavirus package?
We have some other, yes, there's an area in which we can, more funds would be greatly welcome, but this is not a time to be throwing money away and running up the deficit and just spending money because people won't help. Those the small businesses, for example, we had $40-something million in the state go to small businesses, minority businesses, small businesses, and nonprofits. We had about $62 million, and that got absorbed very quickly. So I've asked the legislature for $123 million more. Well, that's an area where we could use some help. A lot of the things that are included in the stimulus package have nothing to do with the virus. Nothing to do with it, and now is not the time to do that. We need to concentrate on the virus, and that's what we need to do now.
Speaking of the virus, Johnson & Johnson vaccine has now been authorized. How soon will South Carolinians be able to receive that vaccine and the volume of doses?
Right. We are told that it'll be here on Friday or Saturday, and that is being done on a per capita basis, as I understood it when we were talking about it. That means we should get about 300,000 doses, or maybe more than that. At least, I think it's at least 7 months. But it'll be here Friday or Saturday. We were alerted this morning.
And you mentioned with the last call, listening that you're calling on South Carolinians to still be responsible
Oh yeah. Well, the fact is the numbers and the experience we had showed it was time to do that. Both the vaccinations increasing, the positivity rate going down, the hospital beds, the number with COVID patients are going down around the country. All those numbers are going down. So it was time in South Carolina to remove those. Those are the last restrictions we had. It was time to remove those.
Last question, if there is.
Governor, we're in a predominantly African-American community. Many of them are hesitant about taking the vaccine. What would you say to address that in light of this clinic and the Johnson & Johnson?
Well, there are a lot of people that have reservations, and we have to understand that people have legitimate questions. We know when we started off and had hospital workers and doctors and nurses and such were the ones that were in the very first category. After the first 2 weeks, only about a third of them had taken the vaccine. So, and I think now that's up to maybe 2/3. But there's still a lot of people, maybe more than that, still a lot of people that just don't want to take it for a variety of reasons. And the best thing we can do is try to explain that, or explain it to people in whom they have confidence in. People like to hear things from people they know and trust. They like to go to places that they've been to before and they know and trust. So that's what we're trying to do. In the rural areas, it's particularly accented there. But those are legitimate concerns, and we're doing our best to assure people that if they want the vaccine, that they can get it. And according to all the experts, it is safe. It has been properly tested. There were a lot of questions about that at the beginning. But I think it's unanimous among the experts that it is a safe, effective, three safe, effective vaccines that have been approved in a much shorter period, but nevertheless have gone through all the tests that they're supposed to qualify for that FDA seal of approval.